The images you are seeing were drawn by 4-year-olds. The children span a wide range of developmental abilities, socioeconomic groups, and cultural backgrounds. I'm lucky to work at a child development center. In preparing for this evening, I was getting so mired down in the layers and nuances of healthcare that I thought, well, maybe I should ask the children. So I sat down with small groups of my little friends and I requested that they draw me a picture of healthy. I really didn't know how it would go, but it turned out that their art and their quoted interpretations, well, basically outclassed a lot of what I had planned to say. So now I'm just going to try to measure up to the bar they have set for me. Originally in my career, I'm a linguist. I love words, I love language, and the study of how we use our words to communicate. So I want to talk to you today about the importance of word choice and definition. I want to talk about what healthcare means to me, to us, and quite importantly, the message of what healthcare means to the people who will be grown-ups after us. My favorite area of study is sociolinguistics, how the words we use influence culture and thinking. If you meet a 14-year-old boy and you repeatedly address him as sir, will it change the way he feels about himself and the way he acts? We use words like wellness and healthcare instead of sick care. Does that matter? At our center, we make a point of using the word friends. So instead of saying, tell the other children what you see, we say, tell our friends what you see. Does it make a difference in their connection to each other? I think the challenge with identifying hopes for healthcare is that we have to start by knowing what healthcare means to us. Asking my adult friends led to all kinds of concepts. They would talk about physical health, the sick, not sick part, emotional health, marital health, preventative health, population health. They talked about acute emergent healthcare, occupational health, prenatal health, and then we got into the rights of the marginalized and patient advocacy. That's how big and layered and complicated healthcare is for us. I have a lot of great stories about getting this art. One of them is about an active young man named Declan, 4 years old. Sitting in a chair isn't really Declan's thing, and he happened to come to me in a grouping of with three little girls who, quite frankly, seemed to care a lot more. We chatted a bit, and then I gave the prompt, draw me a picture of healthy. The girls were on it. They were still carefully deciding on colors when Declan over here says, I'm done. And I look over, and there's a red blob and a green blob and a bunch of lines on Declan's paper. And I say with thinly veiled exasperation, Declan, I thought we were doing drawings of healthy. Declan looks at me with no veil of exasperation. That's healthy. It's a cucumber and a tomato, and they're holding hands. I was very sorry. This is what strikes me. At its foundation, healthcare perhaps isn't that complicated. As adults, like my friends, we are so privileged here to get to conceptualize healthcare as this very broad thing. We get a spacious definition, but we're struggling to fund it all, to stretch our resources that far, and it's easy to get mired down in the complexity and layers. And yet, our little friends, to a large extent, have a pretty broad definition themselves. What would our system be like in 20 years if children were able to hang on to and infuse these concepts of healthy throughout their lives? I didn't leave out drawings. Not one 4-year-old drew a TV or an iPad or pop or a hamburger, no cigarettes, no couches. They know. Did we understand all this when we were 4? I don't think so. We get evenings like this, health talks that look to inspire change. If we can define healthcare to children, to youth, and the rest of us in a manner that infuses responsibility instead of entitlement, if we can get our little friends to hang on to these concepts and these words about health, it might fuel a groundswell change in our culture And that just might make us sustainable. Active engagement in this broad, fantastic definition. I think we're making progress. I think the drawings say we're getting there. Draw me a picture of healthy. For Taylor, that was her family on swings. For Alexa, it was her mom running with a banana. For Callan, it involved a ski helmet so he didn't bonk his head. Amy thought a lot of windows would be healthy, and Maya drew a happy doctor. So let's see, we've got families in parks, a mother who works out with a potassium-rich snack. We've got brain injury prevention, sunlight to ward off seasonal affective disorder, and physicians who smile a lot. 3 children even drew about recycling, the health of the planet. How cool is that? My hope for healthcare, as dorky as it is based in sociolinguistics. If we decide as a community of people to use these words when we talk about health, I think we can create a sustained change. The words will teach personal responsibility. That is the best banana ever. Drawing. I hope for a definition of healthcare that is broad and that continues to prompt the smallest of our friends when they are given some oil pastels to draw princesses with carrots, to draw clean air, soccer balls under beds, sunscreen and friends, even if they are tomato and cucumber friends holding hands. And my very favorite, which I like to think connects to mental health, I hope we have and purposefully teach a definition of healthcare that continues to prompt a friend like Abel to think of healthy as having a really big dream in his head. Thank you for listening to me.